It was important to bring partners together, make sure that people in the healthcare sector and the sectors that we work closely with had all of the right information about what is happening with coronavirus and what is known. We have no new cases. The risk to people in London and Middlesex remains very low, but important to make sure that partners are coming together, getting on the same page, and ready if and when things happen here. The relationship with age and illness is very strong, so the older you are, the more likely you are to have a severe outcome from coronavirus. That's been very clear in the data that's come from China. One of the partners we had here today is working on the regional response for long-term care facilities, so definitely that is something that folks working to support the elderly are looking at very closely. So when we're looking at reducing the spread of infection, social distancing measures are one of the tools that we can potentially use. That would be closing schools, canceling mass gatherings, that sort of thing. We're not at that stage, not indicated at this point, but it may be used in the future here. So the fact that we know a lot about coronaviruses does help with preparing the vaccine. We also, we're at a unique phase in human history where we were able to sequence the genome for this virus within a few weeks of its being identified. So that allows for a whole range of potential vaccine targets within the sequence of that genome. Very exciting time to be involved in vaccine research right now. It's really about proactively getting the message out to students that may be returning from an affected country. Make sure that they know about the countries where we're asking people to quarantine themselves, for 14 days before after they return home. And there's a whole additional list of countries where we're asking people just to be aware of their symptoms, and if they do have symptoms, to call us right away. So it's about helping the institutions get those messages out to the students and faculty that may be traveling. It's so important to look to credible sources and to repeat the information that's coming from credible sources. We are seeing people spreading information that's not accurate, that's not helpful, and that actually contributes to the negative impact that this sort of outbreak can have.